Speech Secrets.
I'm Cassandra. I'm a speech therapist, and welcome to Speech Secrets. Today, we're going to focus on respiration and diaphragmatic breathing. Respiration is one of the building blocks of speech. It is a system involved with speech production. Our volume and rate of speech are dependent on the way we breathe. There are various medical conditions that can interfere with the way we breathe and thereby interfere with the way we speak. These include dysarthria, chronic obstructive pulmonary disease, COPD, or higher level spinal cord injuries. Someone who has had a stroke and has dysarthria affecting their respiration might have difficulty projecting a loud enough volume, or they may only be able to get out a few words with each breath. Diaphragmatic breathing is a technique that activates the diaphragm, which is a major muscle of respiration. The diaphragm sits just below the lungs. It's a dome-shaped muscle that flattens and contracts when we inhale. Using the diaphragm to breathe helps you fully expand your lungs, taking in more air with each breath. This type of breathing can help us to project our voice louder while also reducing vocal strain. Diaphragmatic breathing promotes relaxation and stress reduction and may also be beneficial for reduction of gastrointestinal symptoms like bloating, acid reflux, or constipation. This is because of the way diaphragmatic breathing helps to stimulate the vagus nerve. The vagus nerve runs from our gut to our brain, and it helps to stimulate our parasympathetic nervous system. The parasympathetic nervous system is responsible for resting and digesting. It's the opposite of our sympathetic nervous system, which is responsible for the fight or flight activation. Diaphragmatic breathing has also been shown effective to improve the exercise capacity and respiratory rate for people with COPD. So how do you do it? You can do this while you're standing or sitting or lying down. Usually lying down is easier. First, put one hand on your chest and another hand on your stomach. Take a breath. Notice which hand moves the most. If you're noticing that the hand on your chest is moving, then that's called thoracic breathing. When we breathe like this, we're really just filling the top of our lungs. But if the bottom hand is moving when you inhale, that means you're activating your diaphragm. As you inhale, your belly should rise. Slowly release the breath through pursed lips as the belly falls, with the belly button moving towards the spine. Let's try a few together. Inhale, belly rise. Slowly release the breath through pursed lips as the belly falls, with your belly button moving towards the spine. Inhale, your belly rises. Slowly release the breath through pursed lips as the belly falls. Last one. Inhale through your nose, belly rises. Exhale through pursed lips as the belly falls. If you're having a really hard time activating the diaphragm, one of the techniques I use for folks is putting either my hands or their hands just below their rib cage and applying just some gentle pressure and telling them to inhale while thinking of pressing against my hands on their sides. Another way to tell if you're using your diaphragm when you're breathing is stand in front of a mirror. If when you breathe, your chest is moving up and down, that's a key that you're not activating your diaphragm. Just a good way to get some visual feedback to know if you're using the right muscle group. Don't worry if you can't get it right away. Most people don't. It definitely takes some practice to start activating our diaphragm because we're so used to breathing from our thoracic region. Practice doing this for a few minutes a day. You can start in lying. You can do it while you're in bed or watching TV. and practice doing it consistently. I'm planning on making some videos with other breathing exercises, specifically respiratory muscle strength training, but diaphragmatic breathing is a foundation to get into those other exercises. So keep an eye out for those upcoming videos, and please be kind to yourself. Bye.